one.
So this is Jesse of jessephysio.com. My blog the other day I wrote about what I've learned in 4 years, and one of the things I mentioned that I talked about was a great exercise to help people with shoulder impingement. It's a rhythmic stabilization using a band. I've used this successfully for the past few months now for pre and post treatment success, meaning I'll have someone raise their arm up over their head, and if they have that shoulder arc or that pain, I'll often tell them to remember what that feels like. I'll do the following exercise with them for a couple minutes, retest, and more times than it's not, the patient will automatically say it feels better and they'll have more range of motion. And I'm not using my hands, so there's no manual therapy that needs to be done for that, which is always a benefit. Because the patient feels more in control, that they can take care of the situation themselves, as opposed to me having to fix them. How I think this exercise works, long story short, I think a lot of people get that pain in their shoulder when their humeral head rides up and they can't depress it properly, and it pinches on supraspinatus and long head of biceps, what have you. This exercise teaches the rotator cuff muscles to kind of depress and hold the humeral head in place. So all you do, this exercise, is you have the patient bring their arms straight up. I instruct them to imagine that ball and socket joint, and you're kind of thinking of keeping that shoulder blade back, the humeral head in place there. And the patient just wrap that band around their hand, okay there. And I'm going to put tension on the band, and I'm going to pull, and she's a slight bend in her elbow, nothing too crazy, and I'm going to pull in different directions, walking around the bed, and her job is not to move. Don't let it move. Engage your core if you need to. And then I can just kind of come in different positions. I can hold it down, I can bring it up, and that's just teaching that rotator cuff to hold that humeral head in place. And I do that for sets of about 10 to 20 seconds. I give it a break, and I repeat that 2 to 3 times on retest, and again, oftentimes it's a lot better. So that's kind of my rhythmic stabilization. Similar to doing something more of a manual, so I can use my arm, my hands to keep the humerus in place. I'm just using a band and kind of pulling, okay? Thank you very much.